The broadcast is now starting. All attendees are in listen-only mode.
Thank you for joining us today for the National Conference of State Legislatures webinar, Biomonitoring, Measuring Chemicals in People. Today's webinar is hosted by NCSL in collaboration with the Association of Public Health Labs and the Centers for Disease Control and Prevention. For a schedule of upcoming webinars, please visit NCSL's website at www.ncsl.org. My name is Doug Farquhar, and I am the Environmental Health Program Director at NCSL. I'll be moderating today's webinar. The session will discuss how state labs in New York, New Hampshire, and at the Centers for Disease Control and Prevention use biomonitoring to determine how and which chemicals may be affecting the public's health. Before we begin, I would like to mention that this webinar is being recorded and that registrants will be able to access the recording of the webinar and the presentation slides on the NCSL websites. We will send out a notice shortly with the link to these resources. Today we have the pleasure of having three speakers with us. Dr. Christine Bean, the New Hampshire State Lab Director, Dr. Ken Aldis, New York State's Department of Health Lab Director, and Christine Dortch from National Center for Environmental Health. We're going to have a little bit of a shift in our speakers. I'm going to ask Chris Bean from the New Hampshire Department of Health to be our first speaker. Dr. Chris Bean is the director of the New Hampshire Public Health Laboratories. She earned her PhD in microbiology at the University of New Hampshire, her Master's of Business Administration from Southern New Hampshire University, and she received her Bachelor's of Science in Medical Technology at the University of New Hampshire. She's worked for the New Hampshire Public Health Laboratory since January 2005, and she's just completed her term as the past president of the Association of Public Health Labs this year. With that, I'm going to ask Dr. Bean to talk a little bit about biomonitoring and how that affects the public health, and then also how it's affected for the New Hampshire State Laboratory and the New Hampshire program. With that, Dr. Bean.
Thank you, Doug. I'm very happy to be here today to talk about biomonitoring and about Biomonitoring New Hampshire. First, biomonitoring is the measuring of the amount of a chemical in people rather than in the environment. So what I'll be giving you an overview of, one of the studies that we're working on in New Hampshire is implementing a study to look at chemicals in humans. So we're looking at human biological samples and measuring levels of chemicals. Next slide, please. In 2014, CDC's Division of Laboratory Sciences had a competitive cooperative agreement that went out, and New Hampshire was one of 20 applicants who applied for funding to implement biomonitoring programs at the state level, and 6 states were selected, and you can see that on this slide, and the 2014 funded states are in green here. New Hampshire was one of 6 states that received funding. We have a 5-year cooperative agreement from CDC for a total of $5 million. And one of the projects that we have been working on is a targeted arsenic and uranium public health study that is what I will be focusing on today for my part of the talk. I'll mention briefly a statewide surveillance project that will be the second part of our cooperative agreement. One note I'd like to make before we move to the next slide is that the cost of a proper biomonitoring study is quite significant, and you see that from the dollar amounts here. And without this CDC funding in New Hampshire, this work would not be a state priority. So we have been the recipients of this funding, which has allowed us to hire personnel and purchase equipment and be able to implement this program. Next slide. So in the state of New Hampshire, 46% of the state population is reliant on wells, private wells, for drinking water, which is quite high. We have a geology and agricultural history here, which we are named the granite state for a reason, and that is there's a lot of granite in our geology, and that can contribute to arsenic in well water. In a previous small study that was performed, 31% of samples that were collected in the southern region of the state exceeded the arsenic MCL, which is minimum contaminant level. And in several of those samples where arsenic was detected, there was also an elevated level of uranium detected. So this was taken into consideration when we began to put together our planned study for the first part of the targeted biomonitoring program. Next slide. So we worked with the Department of Environmental Services in New Hampshire to create communication tools for the public, which would help to assist them to understand different types of wells and what the implication of having those types of wells are. What we began to see when we were asking questions of people is that many people did not truly understand even exactly what type of well they had, whether it was a dug well, a driven well, a drilled well, which could make a difference in their risk of these contaminants. Next slide. So in the targeted study, we looked at across the state at multiple counties, and including Hillsborough, Stratford, Rockingham counties, some different towns. And you see, based on data that we had from the Department of Environmental Services, that we knew where there was probability of high arsenic. And this is based on USGS ground monitoring. And we targeted recruitment in 28 towns, and you can see these highlighted here. Our goal in the study planning was that we would have 500 participants recruited to participate in the study, and a control group of 50 participants who were not on well water and on public water. So we began to engage with communities to build momentum, and we knew that in some of the towns there were very active drinking water committees, and we began with those communities because we knew we could kind of build off of the community momentum that was already ongoing to work on our plans. Next slide. So we targeted high and low risk areas. We joined community meetings and events. We had news releases. We do have access to social media where we got our messages out through social media and our website, which I'll show you in one of the next slides, and also some postcards that were used to mail out to target specific towns, specific households that we knew were on wells in towns. And those were mailed to try to recruit participants in the specific towns that we selected to study. Next slide. So because we know that there's a significant correlation between the elevated drinking water arsenic level and possibly higher than average total urinary arsenic, these are some of the specific areas in the proposed study areas that we were looking at here on this slide. Next slide. We were able to get well data from the New Hampshire Department of Environmental Services. We looked at tax data from the New Hampshire Department of Revenue Administration, plus a GIS analyst, and we were able to confirm residences with wells. And those postcards were sent directly to the resident, to the household, named resident of household. So they went to houses that we knew had wells. Next slide. We worked, I'm sorry, you can go to the next slide. We worked with specific communities. Our laboratory staff went out to introduce themselves to selectmen in the towns. We worked closely with health information or health officers in the town areas so that the communities would understand what we were doing and what we were proposing so that they would not hear about it via some other way. And we also, based on that, were offered a lot of assistance from the towns, which was wonderful. So we were offered the town offices and library meeting spaces. They offered to pass out our literature and post information on their town websites. We attended health officer meetings, and as people were able to ask questions about how our study related to other national exposure reports, and we really engaged with the communities. Next slide. This is a sample recruitment postcard. As you see in the bottom right-hand corner, they got their well water tested for free if they were willing to participate in our study. There was no charge to them. What we were asking from them is, would you be willing to participate? And with that, we need well water from your home, and we need urine from your body. So we're doing environmental testing and biomonitoring, or testing their urine for arsenic and uranium. The next slide is the reverse of that postcard, which just gives more information. We need your help. Why? How long will it take? What do they have to do? What can I get in return? And then links to our website. So this was quite informational. And they could go on the website at their leisure and find out more information about the whole program. Next slide. We also posted, as I mentioned, on our department website. So this is the New Hampshire Department of Health and Human Services website. What is biomonitoring? There's a full definition. There's a link to our study page, and then just some, basic frequently asked questions. How do chemicals get into our bodies? Why is it important to take a look at these things? And I think this information was very well received from some feedback that we got, that we continue to get as we go forward with the study. Next slide. We also collaborated with academic partners in the state of New Hampshire. So there are others in New Hampshire, including Dartmouth College, who are working on studying some of these chemical contaminants in humans. So we worked together so we did not duplicate efforts, and we certainly don't want to bombard people with duplicate solicitations in the state. So these are just some examples. We also worked with the University of New Hampshire, where there is a Masters of Public Health program, and we were able to get some graduate student assistance with development of some of these communication tools. Next slide. Another medical partner that we worked with, that we continue to work with ongoing, is Dartmouth Primary Care Research Network. And these people are working with community practices to distribute water test kits and encourage water testing at the time that a patient comes in for a primary care appointment. So we've given our first round of water kit collection disseminations to 12 community practices in the state of New Hampshire. We provide the kits to the primary care offices, and the kits go out to the patients, and it's an opportunity to educate the patients about environmental health issues at a well care visit and encourage them to be testing their water. Next slide, please. So just the next couple of slides are just some educational materials that I thought I'd include because they're pretty useful to take a look at. These are some of the education fact sheets that were created by the Masters of Public Health students. We asked them to review health literacy guidelines and come up with our own infographics so that people could understand and have visuals on some of these things. One is on arsenic. The next slide is one on uranium. So a lot of effort around communication tools. The next slide shows a picture of the interview meeting. So for the participants who agreed to be part of our study, we went out, and it's still ongoing. We have half our participants recruited already, about 250 people. We are going out and meeting with the people in person, so in a public place, as I mentioned, and they sign an informed consent. They go over exposure questionnaires, food logs, as some food intake could influence arsenic levels in the biomonitoring samples, and then explain to them how to collect their urine specimen and their water collection specimen. So it's a face-to-face meeting with the participants. Next slide. So our CDC biomonitoring funded staff, just so I could mention that, includes 2 epidemiologists and 3 laboratorians. And this is an example of all of the lab testing that we perform. I won't go through all of this because I'm running out of time already. But we test the urine for the analytes on the left-hand side, and we test the water for a group of contaminants that are listed on the right-hand side. So this is the testing that they get. In the next slide, I'll show you a sample laboratory report. This is just a sample report of what the participant would get back with their results on it. We actually, before we started, we did a pilot study on around 12 participants, which allowed us to get feedback on the whole process, including the reports and how easy they are to understand. Excuse me. Next slide. Included with the reports is a frequently asked questions sheet on arsenic, so this is quite helpful for the participants to have this information. And the next slide shows a water report, sample water report, drinking water results with levels and interpretations on that. We were also fortunate to have in the state of New Hampshire, on the next slide shows a website that was designed by the Department of Environmental Services to help users of our laboratory services understand water testing results, and it helps to provide information about health concerns and water treatment choices. So if someone has their water test results, they can plug them into this website, and it's kind of fun to play around with it if you wanted to log on to it and see. It can help people understand what their test results mean and what next steps that they may need to take. Next slide. So we will be reporting and having community meetings as our study goes on. The water test results are being reported in real time to the participants. The urine results will be reported at the conclusion of our study so that we can report the individual results in the context of the 500 participants. And result interpretation aid will be offered at community meetings. We'll go out to community meetings and present the results as a group, as well as the individuals will report those confidentially individually. Next slide. Next steps for our program include continuing to recruit and test for the arsenic and uranium study this summer. As I said, we've reached half the participant level, and our goal is to recruit and collect the samples on the remainder. We're working with environmental public health tracking to have a wisdom data dissemination module so that these results could be looked at as a whole, as a group for use in the future and for dissemination. We'll continue our partnership with Dartmouth Primary Care to disseminate water testing kits. And then we plan to begin our surveillance project to study New Hampshire-specific NHANES data in fall of this year, fall of 2017. So my next slide is my last slide, which has contact information for program people in New Hampshire, myself, our program manager for the chemistry program, our epidemiologist and toxicologist leads for the CDC biomonitoring program. Thank you very much.
Thank you, Chris. That was very informative. Next, we are going to ask Kristen Dortch from the CDC National Center for Environmental Health. She's with the Division of Laboratory Services at the National Center for Environmental Health, and she's going to give us an introduction to CDC's biomonitoring program. With that, Kristen?
Good afternoon. Thank you. So thank you for this opportunity to present an overview of the national and state biomonitoring program supported by CDC. If we can move to the next slide. So what is biomonitoring? Every day we are exposed to hundreds of chemicals, whether those chemicals are found in the food we eat, the air we breathe, the water we drink, soil we grow our food in, dust found in our homes, or many personal care products we use. We can determine how much chemicals we are exposed to and what actually gets into our body by using biomonitoring. Next slide. Biomonitoring assesses which chemicals stay in our bodies by measuring the internal dose of a chemical, its metabolites or reaction products in human samples, such as blood, urine, or saliva from all sources of exposure. There are many exposure assessment approaches, including questionnaires, evaluating historical information, environmental monitoring, and biomonitoring. Biomonitoring is a useful tool for exposure because it includes all sources and routes of exposure. The types of biomonitoring studies include large-scale surveys, epidemiological studies or specific populations, and emergency investigations or disease clusters. The presence of an environmental chemical in the body does not necessarily indicate harmful exposures, and monitoring exposures can aid public health research to determine what is harmful. In addition, biomonitoring data can help inform voluntary product changes in product formulations, public health policy changes, and regulatory actions that can lower exposures. Next slide. The National Biomonitoring Program provides laboratory science that improves the detection, diagnosis, treatment, and prevention of disease resulting from exposure to environmental chemicals. The program's major study is the National Health and Nutrition Examination Survey, or NHANES. Next slide. The Division of Laboratory Sciences and the National Center for Environmental Health at the Centers for Disease Control and Prevention supports many programs that support public health response among the 7 different branches. But today I will highlight the National Biomonitoring Program. Next slide. The National Biomonitoring Program is the most comprehensive assessment of U.S. population's exposure to priority environmental chemicals using high-quality biomonitoring laboratory methods. The program assesses environmental exposures in more than 65 studies per year. An additional goal of the program is to also provide analytical support, training, and technology transfer to state and local laboratories to support investigations of known and potential harmful exposures. Next slide. The National Center for Health Statistics conducts the federally funded NHANES study, which provides the data for statistical representation of exposure in the United States population. The first NHANES study began in 1971, and then since 1999 has conducted continuous survey cycles every 2 years. The MEC Lab, or Mobile Examination Center, visits 30 locations across the United States, conducting face-to-face interviews to discuss a participant's medical history, physical examinations such as height and weight, and collecting biological specimens, including urine and blood, for analysis. DLS measures biological samples using complex analytical methods for clinical chemistry, nutritional biomarkers, and environmental chemicals. Next slide. CDC's National Report on Human Exposure to Environmental Chemicals and Updated Tables provides the most comprehensive assessment of Americans' exposure to over 300 environmental chemicals. The data is used by scientists and public health officials to establish national exposure levels or reference ranges for these chemicals, trends over time, and identify harmful exposures. The tables are updated every year with new biomonitoring results. Next slide. Recently, CDC released the new updated tables in January of 2017. It provides data for 304 chemicals, of which 20 are new and 96 have updated data since the previous updated tables in February of 2015. Next slide. The National Exposure Reports can track changes in the U.S. reference ranges over time and help set priorities on studies of exposure and health outcomes. Next slide. An example of monitoring trends is the exposure of PFOS, which is a synthetic chemical used to keep food from sticking to cookware or make clothing waterproof. These chemicals do not break down easily in the environment and may bioaccumulate in the body. The production of PFOS was phased out in 2000, and the bar graph on the left shows the changes in the production over time. The chart on the right shows a steady decline of PFOS human exposure based on data collected from NHANES cycles since 1999 and shows the 68% reduction. Next slide. Exposure trends of phthalates and organophosphate insecticides may change over time. The bar graph on the left shows the exposure trends for two different phthalate metabolites, which are found in plastics. As the manufacturing of DHEP decreases, there's a 67% decline in exposure levels in the U.S. population. However, there is also an increase in exposure for DINEP by 265% since the phase-out of DHEP. The bar graph on the right shows the exposure trends for organophosphate insecticides, which are used to kill many types of insects, but were phased out in 2000 by policy regulations. Since the phase-out, there was a 56% reduction in exposure levels at the national level. However, there was a 44% increase of pyrethroids, another class of insecticides. Next slide. Another example of a public health impact is reducing exposure to secondhand tobacco smoke in U.S. population. NHANES measures the nicotine metabolite cotinine, and since 1988, the secondhand tobacco smoke exposure has decreased by 84% in the U.S. population. Next slide. So CDC's biomonitoring data are a national representation of exposure and do not provide exposure information by specific state or locality. The State Biomonitoring Program provides an assessment of human exposure to environmental chemicals at the state and local levels. Next slide. CDC launched the State Biomonitoring Program in 2001 to help states use biomonitoring to assess chemical exposures of concern in their communities. In 2001, CDC distributed $10 million for biomonitoring planning to 25 states and regional programs, supporting a total of 33 states. In 2003, CDC funded 8 states, 2 individual states, and 1 consortium of 6 states to put their biomonitoring plans into action. And in 2009 was the first 5-year cooperative agreement grant where CDC received dedicated funding to expand state laboratory capacity for biomonitoring and awarded a total of $5 million annually to California, New York, and Washington to support their programs. In addition to financial support, DLS also provides non-financial support by providing analytical method training, advisory services, and site visits. CDC will use ongoing communication with awardees, including monthly conference calls, work plans, performance measures, and evaluation plans timelines, and yearly site visits. Next slide. The current cooperative agreement is the 2014 to 2019 awarded cycle. The program's purpose is to increase the capability and capacity of state public health laboratories to conduct high-quality biomonitoring science and assess the human exposure to environmental chemicals within their jurisdictions. Next slide. The state programs develop biomonitoring capabilities through collaboration with epidemiologists and laboratorians to develop studies that meet the state's project goals. The epidemiologists develop the study design and include the participant recruitment and enrollment process, data collection and management, and reporting results back to participants. The states are also responsible for obtaining IRB approval for the study. The states are required to establish and use an advisory board panel of biomonitoring experts to share laboratory best practices and guide programmatic priorities. The laboratory is responsible for developing and validating analytical methods, processing the test for human urine and blood samples, and ongoing analysis of measuring the state's chemicals of concern. The states are also expected to participate in proficiency tests to ensure the accuracy of their methods. Next slide. So now I'd like to highlight some of the state's projects. Biomonitoring California is a multi-agency program that has successfully launched several studies assessing environmental exposures in California residents and recently celebrated its 10th anniversary for biomonitoring. The program continues to make progress toward achieving statewide surveillance by assessing samples from the Measuring Analytes and Maternal Archive Sample Study. California has generated data for targeted studies that represent California, specific populations, or unique exposures, including the Foam Replacement Environmental Exposure Study and the Asian Pacific Islander Community Exposures Project. Next slide. The Four Corner States Biomonitoring Consortium leverages resources among the states of Utah, New Mexico, Colorado, and Arizona. The program develops strategic partnerships with existing programs and collaborate with each other to increase analytical capability and capacity. The consortium has launched successful targeted studies assessing exposure among private well drinking water residents, San Luis Valley children, and tribal communities. Next slide. New Hampshire has implemented two distinct biomonitoring projects. The first is their targeted investigation to determine prevalence of elevated arsenic and uranium, which you just heard from Chris Bean from their laboratory. And then their second study is the statewide surveillance program to assess multiple chemicals of exposure. Next slide. The Virginia Division of Consolidated Laboratory Services conducts high-quality biomonitoring science for population studies, improving public health and safety for citizens of the Commonwealth of Virginia. Virginia has successfully launched the exposure of Virginia residents to toxic metals and perchlorate through partnerships with community colleges to recruit study participants. Next slide. The Massachusetts Department of Public Health has successfully launched several studies, including a statewide surveillance assessment of residents for metals and polychlorinated biphenyls using a population-based sampling system through the Behavioral Risk Factor Surveillance System Survey. Next slide. The New Jersey Department of Health has collected over 1,000 samples for assessing exposure to environmental chemicals by collecting samples from clinical laboratories across the states to assess exposure based upon geographic locations. In addition, New Jersey is developing two targeted studies to evaluate the exposure interventions among study participants. Next slide. New York and Washington were previously awarded funding through the cooperative agreement in 2009. Since then, both programs have sustained biomonitoring capabilities and continue to address the needs of communities within their jurisdictions. Next slide. In conclusion, Biomonitoring is an analytical health assessment of chemicals directly in a person's body. The National Biomonitoring Program NHANES study provides ongoing data on the exposure of U.S. population to environmental chemicals and reports data in the National Report on Human Exposure to Environmental Chemicals. DLS will continue to provide financial and non-financial support for state biomonitoring programs. The state biomonitoring programs help to address the need for additional studies to assess exposures in local or targeted populations. And finally, CDC is working together with the Association of Public Health Laboratories and state biomonitoring programs to promote a system-wide network in collaboration called the National Biomonitoring Network. This network will provide critical non-financial resources for all states and local programs interested in conducting biomonitoring to increase the use of high-quality biomonitoring studies. Next slide. Thank you for your time.
Thank you, Kristen. Our final speaker today is Dr. Ken Aldis. Dr. Aldis is the Director Emeritus at the New York State Department of Environmental Health Sciences. He's a faculty member at the Wadsworth School of Laboratory Sciences and an Associate Professor of Environmental Health Sciences at the School of Public Health. With that, I'm turning the mic over to Dr. Aldis.
Thank you, Doug, and welcome to those listeners that are continuing on the webinar. It's been good to be at the end of these two excellent talks because they've covered a lot of the information that is important for understanding biomonitoring. I want to discuss briefly how New York was able to respond to recent public exposures from drinking water contamination, and specifically for the PFAS target compounds. Next slide, please. As has been mentioned, we are surrounded by chemicals in our exposome, as we call it. And in the middle there you see water is one, but there are clearly many other places where we can be exposed to chemicals. There are about 2,000 new chemicals introduced into commerce each year, and we need to be tracking these materials as they are coming out into various products that we are exposed to. The next slide shows something of our need for state-level biomonitoring capacity. As Kristen said, the CDC runs a very large and elaborate and highly well-organized NHANES program, and this provides data which is representative of the nation and gives us reference ranges, but it doesn't provide exposure information by specific state or locality. And so, as you've seen in New Hampshire and some of the other states that were funded by CDC, they're now doing local biomonitoring studies. And this is an important ongoing task that state labs are responsible for. The next slide, please. One of the things that we have been fortunate to obtain is funding for the what's called the Lab Response Network. We were funded for many years for biomonitoring through the cooperative agreement, but many state labs, most state labs, are part of the Lab Response Network. They're funded again by CDC for preparedness activities, and there exists in these labs infrastructure and its nascent capacity for biomonitoring studies that can be undertaken. And I think for the states that have these capabilities, they can indeed leverage them to do this sort of testing. So New York's applied the existing chemical infrastructure to respond quickly to emerging issues. I'll explain on the next slide what the LRNC does. It is a separate unit that can respond to chemical issues within the state and even nationally. So we have skilled analysts, we have instrumentation that's being funded by CDC. It's maintained in good working conditions, and we have to be prepared to analyze samples at very short notice. There are 53 labs that can have this sort of ability and can access and respond to local problems, and 10 of the labs have national, what are called surge response, that can assist CDC. In the next slide, we see that the two compounds that we are concerned about is, did we jump 2 slides? Okay, thank you. We see the two perfluorinated compounds that are known as perfluoroalkyl substances, PFASs, that we'll be talking about and have already mentioned. These are very persistent compounds in the environment, and they have these long 8-carbon chain alkyl groups that are fully fluorinated, so they're extremely stable. Next slide, please. So biomonitoring has gained public interest through recent events. Flint, Michigan, we have learned about the lead issue, and lead has been a biomonitoring target for many, many years in children, and it really started biomonitoring, certainly in our lab, and has gone on through the years. PFASs are included in the NHANES biomonitoring, so we have a reference range to work with, and our biomonitoring allows us to provide public health service with accurate and defensible, clear, compliant results to residents if they are involved in these studies. We get a biomonitoring database that's available from each study, and then we can evaluate. If we then go back and re-sample people with the same targets, we can see if remedial action have caused an improvement in exposures. Doing these studies improves our outreach to partners within the hospitals and public service centers, and this, I think, is important in being able to respond rapidly to emergencies. So we've spent some time during this last 2 years that we've been working on this type of project in being able to move data from public service centers to the lab and report back out to various places. Next slide, please. So I'm going to go over 2 different situations in New York. The first one is Hoosick Falls. It's a small village within a town of Hoosick, and it's a little distance from Albany. It has a population of 6,700 with 3,600 living in the village. The water there was contaminated by a plastics plant, and the 3 wells tested to that sort of range between 150 and 662 nanograms per liter of PFOA. That's in parts per trillion. This was exceeded some guidelines, and we measured this in the about 2 or 3 years ago. The building on the bottom left is the armory, and we use that as our point of contact with the people in the village and the town. And you saw from Christine Bean's talk how important it is to have the peripheral interactions going on with the public meetings, with all the information that needs to flow as one is doing a biomonitoring study. Next slide, please. The first thing that obviously we needed to do was to reduce the level in the drinking water. It was a public water supply, so carbon filters were installed. We dropped the level down to less than 2 parts per trillion. The EPA during 2016 set the health advisory to 70 nanograms per liter, 70 parts per trillion of the combined PFOA, PFOS, so we were well within that. That's a lifetime health advisory level. The next slide shows our second site, which is Newburgh on the Hudson River. Newburgh has 28,000 population, and so we realized very quickly that we needed a very agile and fast response to be able to turn around samples from thousands of people that may be requesting serum testing for perfluoro compounds. The next slide will show the drinking water profiles, and now I'm introducing some of the target compounds that exist in the perfluoroalkyl substance profiles. On the left of the two bar charts is PFOA, and the second one is PFOS, and you can see the difference between a plastic manufacturing plant which has PFOA predominant, and in a water supply that's impacted by firefighting foam, which contains more of the PFOS, the sulfonic acid. So these profiles were in the water. We clearly had issues. Newburgh water had to be sorted, which it was by various means, including carbon filtration, but also transferring the source water, which was actually originally a lake, over to an aquifer from the Catskills. Next slide, please. So as has been described, we need to collect samples of serum. This has been done for Hoosick Falls in the Armory. We set up capability to do that. We've also used public service centers within Newburgh to allow us to obtain blood specimens collected by professional phlebotomists in the appropriate way. We have to be very careful when we collect biomonitoring specimens not to contaminate them, and so all the equipment that's used has to be carefully screened for contamination. The next slide shows how we were able basically to do this. The issue was testing several thousand participants in the study, and we requested to leverage the lab response network capabilities to develop an initial PFOA method using the instrumentation, the high throughput instrumentation that was available through the LRNC operation. So within about 8 weeks of having our methods up to clear compliance standards with all our standard operating procedures in place, we were able to run about 2,000 samples. And I'm going to try and give you some information on what the data looked like from the that initial group of 2,000 plus samples. In the same time, we were developing a method for the 11 PFAS targets that are in the NHANES, so we now have a method for serum using, again, clear standards, and we can apply this to emerging issues in New York. We projected the workload is going to increase, and I think biomonitoring is an increasing area. The next slide, please, will just indicate that the key components of each biomonitoring project involves sections of the public health organization working together to allow efficient sample flow consistent with maintaining good data quality in terms of the results and the data that's being collected, the demographic information. And clearly, New York's department is large. We had to coordinate that through the Center for Environmental Health. The only way we could do this is with great teamwork, and I compliment our Center for Environmental Health in helping us be a part of that complex activity. The next slide, we start to look at some of the data, and the following slide, next slide, will show that in that first section of testing in February, April 2016, we had 2,000 people that were came to the armory and provided demographic information and a sample of serum. Serum is collected by taking whole blood, and it has to be spun down fairly quickly, so it's done on site. So that's an additional task that has to be done at the sampling point, and this is Hoosick Falls. So the next slide gives an idea of the levels that were found in blood. These are serum samples from different places across the country that had had similar incidents, and you can see that the people that were on Hoosick Falls public water fall within that range from the Little Hocking in Ohio, which was very high, down to West Virginia. If we include the total residents of Hoosick, the level is obviously smaller, and the US population from NHANES is down at the bottom there. The next slide gives us some demographic information, and it shows on the left the difference in 50th percentile levels of PFOA going from 18 to 39-year-old out to 60 and above. So we can see as one's age goes up, one is exposed over a longer period of time and built up a body burden. On the right side with the purple bars, we see that the number of years on the village water also impacts the level, as one would expect it would, because obviously the number of years is correlated with age. Next slide, please. This is looking at children under 12, and just to get a sense of the levels of those that were currently on Hoosick Falls water. This is all in micrograms per litre, parts per billion, and you can see that if they were never served by Hoosick Falls public water, their levels were down around 5 parts per billion. The next slide shows serum profiles for Newburgh and the drinking water profile for Newburgh, and we'll see that there are some interesting differences. This is something that obviously biomonitoring can provide in terms of data. It can provide the serum level profile along with the drinking water profile, and gives some idea of how these compounds are sustained in the body or are metabolized away. The next, and I believe penultimate slide, mentions some of our ongoing work. The continuing monitoring of drinking water around the state, looking for emerging contaminants that are maybe going to be our next biomonitoring targets. We have to monitor the carbon filtration systems that are in place to make sure they're not breaking through and releasing the fluoro compounds back into the distribution system. There are other impacted areas that we're looking at, and we'll be generating, I'm sure, biomonitoring from them. And obviously we're going to want to report on our project findings and ongoing method developments. The final thought is that we could not have done this work without support from CDC in terms of the lab response network support, from all the information that we've gathered over many years from the biomonitoring studies that we have done. And this was, in fact, and continues to be a team effort within the Center for Environmental Health at the Department of Health and the Office of Public Health, as well as the lab that does the actual analytical work in terms of measuring these compounds. Thank you.
Thank you, Dr. Aldous. We do have a few moments here for some questions, and some questions have come in. The first one goes to both Chris and Ken, asking essentially how much does a biomonitoring program cost? How much resources does it cost to run one of these programs? It seems that the New Hampshire program is very much funded by the CDC, and it seems like the New York program is a mix between state and federal funds. Do you want to discuss just how much, kind of how much resources does it take to run one of these programs?
This is Christine. I think I could start. I believe because we are we're newer at biomonitoring and we're in the implementation phase of our cooperative agreement from CDC, we are fully reliant at this point on federal funding for this work. We would not have the ability to implement the human testing or the biomonitoring part of this program without federal funds. For the environmental side, we do have a water laboratory in our lab that is partially or actually mostly general funds from state funds. So our water environmental lab is funded with state funds, and part of their routine work is to do a lot of the water testing that will be supportive of our biomonitoring efforts.
This is Ken for the
accommodations. Go ahead, Ken.
I was going to say for the environmental, it's very similar to New Hampshire. For our biomonitoring, clearly some of the instrumentation we use is extremely expensive, and the only way that we have been able to do this is through CDC funding initially. Once you have an instrument, it has a lifetime. But there are other mechanisms for funding. The state has partially helped us for the Hoosick Falls and the Newburgh. Whether money will be recovered from the polluters, I don't know. That's something that's possible.
Great, thank you. There's also been a question that's come across asking, how has biomonitoring data been used to address policy issues? Have you been able to change your policy or amend policies to make them more reflective of what the data has shown?
I guess I would say that what we have been able to show is the impact of legislation or regulation on exposure. Certainly with secondhand smoke, when the Clean Indoor Air Act went into place in New York, we were fortunate enough to be looking at exposure during that period of time and could show that there was a decrease. And as I think Kristen showed, many, including secondhand smoke, has dropped over the years, but also things like lead, where you remove these compounds. We did a study with newborn blood spots, looking at the perfluoro compounds, and we certainly could see a reduction in the levels in newborns from the blood spots after there was an agreement to pull some of those perfluoros off the market.
We got one final question here. Actually, we have several questions, but the last one I think we'll have time for is directed at the CDC. Does the CDC have funding available for emergency biomonitoring programs? Like if something came up in the States, would CDC either be able to fund something, or would they be able to come out and do a biomonitoring program? Or is the CDC effort limited to just these grants that come out to the states?
So currently, CDC provides funding for both the laboratory response network that has the capability to have emergency response, and then the cooperative agreement grants for biomonitoring. If there's an emergency situation in one of the states that they need assistance from CDC, we also have our other agency, ATSDR, that provides public health assessments or health assessments and exposure investigations. And so if they determine that there is a need for biomonitoring, CDC also has the laboratory capabilities in an emergency response situation.
Great. Well, thank you very much, Kristen. And with that, I'm going to say thank you to all our speakers, Dr. Christine Bean, Dr. Ken Aldis, and Kristen Dortch from the CDC about speaking today on biomonitoring. I want to, in final, to let you know that this webinar will be archived on the NCSL website. And if you have any additional questions, please feel free to either contact myself or Gretchen Du Bois at NCSL or contact the speakers directly. With that, I'm going to say thank you and have a great day.